Hi, and welcome to Nurses Notes 101. My name is Alexa, and we'll be talking about preload and afterload. The topics of discussion today include the definition of each, so the definition of preload and afterload, the effects that these have on the heart, and the treatment of the inadequacies that can relate to both preload and afterload. Right here to the right of the screen, we have a picture of the heart and all its components, including the atriums and the ventricles, and we also have pictures of the valves in between. So, first off, preload is also known as the stretch of the heart. The true definition of preload is the volume of blood in the ventricles at the end of diastole, or the end diastolic pressure. Preload can either be increased or decreased in patients, depending on what conditions they have going on. An increased preload can be portrayed as hypervolemia. And another patient who can have increased preload is if they have a regurgitation of cardiac valves, or also patients in heart failure. Preload is decreased in patients who are losing blood, patients who are hypovolemic. And to put this all together, increased preload equals an inadequacy of systole. So let's say that the patient's in heart failure, they have too much fluid in their body, their heart is not going to be strong enough to have an adequate pump, which equals the inadequacy of systole. But on the other hand, let's say that the patient is hemorrhaging, they are multi trauma, they are not maintaining their blood count, so they're hypovolemic. Also, so with a decrease in preload, that will also equal an inadequacy of systole due to not enough blood being circulated in the system. The second picture on the left side illustrates cardiac output, which is stroke volume times heart rate. And we see the three components of stroke volume and heart rate, which include preload, contractility, and afterload. Preload, like said before, is the volume of blood in the heart prior to systole, and afterload is the resistance of the heart um, to push the blood out during systole. So, effects that would increase afterload, like depicted in the picture, are hypertension and valvular stenosis, which we'll go over in the coming slide. Next. Just like preload is the stretch of the heart, afterload is the squeeze of the heart. Afterload is the resistance of the left ventricle to overcome and circulate blood. Afterload is increased in hypertension and patients with vasoconstriction issues. To put this all together, increased afterload equals increased cardiac workload. So, with these patients who have hypertension and with these patients who vasoconstrict, we want to release that extra pressure and assist with the cardiac workload and try and lower that workload to make it easier for the heart to pump out the blood. On the left side of this screen, you can see how the preload is working and how the afterload is working, causing that resistance on the heart to contract. To make points clear as well, so preload and afterload is something that is necessary in cardiac contractility and diastole, but we have to make sure that the heart is set up adequately to perform these functions because these extra stressors in the body that I'm highlighting affects a patient's cardiac output. So, ways to optimize preload and afterload. If a patient is hypovolemic, we optimize preload by giving fluids. So, say the patient's cardiac output's down because they are hemorrhaging, the best way to enhance cardiac output if their preload is low is to give fluids. Another way to optimize preload would be to control AFib. So, say someone's in an abnormal heart rate and rhythm. If the rhythm is causing the heart to quiver and not pump effectively and not eject blood effectively, if we slow down the heart, that will maintain and control an adequate preload, which will assist the heart and prevent excess stress onto the heart. Say the patient is overloaded, so they're hypervolemic, they're in somewhat of a state of almost heart failure. They're overflooded with fluid. They could even be in kidney injury. And this could also just be from valvular regurgitation. What we want to do at this point is treat with medications. If these medications aren't helping, then the last resort would be to have valve replacements or repairs. And as we know, ways to treat hypervolemia include giving diuretics, things of that nature. If we think and we know that the reason that their cardiac output is decreased is due to a hypervolemic state. The last thing we would want to do is give a diuretic to a patient who is hypovolemic because then we're only going to make the cardiac output worse. Afterload, the way we could optimize this in a patient who's hypertensive or vasoconstricting is to give a vasodilator like nitroglycerin. This will help to open the blood vessel and have the heart adequately perfuse more blood vessels and have it easier for the heart to pump out the blood. Another utilization that we could do is to give morphine. Morphine given for afterload actually helps to decrease myocardial oxygen demand, which in return will prevent the excess stress on the heart that it can suffer when it's pumping. Thank you so much for listening to my channel. Please hit the like button and subscribe if I taught you something.